would like to call our meeting to order. Welcome everyone to the Board of Health. I'm Kay Leach. I'd like to introduce everybody, but we don't have the video yet, so that's very difficult to do. Shall we proceed on to election of officers?
I apologize, but I do not have a start video button.
Okay. Penny, you want to give me, or Margie, one of you want to give me some direction here on, may we go on with the agenda verbally?
Technically, I think we're supposed to be able to see and hear everyone.
That's what I remember was written.
Yeah, that's what I thought too.
Yeah, so I think we're going to have to, do you have on your screens a start video button?
Yes, but the host, it says the host has to let us in.
So yeah,
Gotcha.
cannot start your video because the host has stopped it, is what it says.
Gotcha. Okay. I think we'll wait until maybe Jonathan can get some direction from maybe one of his colleagues at TSD. You could go ahead, I think, and just maybe just announce, kind of go through the history of each of you like you normally do. That's not voting or official action, but you guys could introduce yourself even without video if you want.
Well, that sounds good. I'll start. I'm Kay Leach, and I have served as chair for the 2021 year. This is an organizational meeting. We'll be doing election of officers again tonight. I think I joined the board around 2010, 2011, after I retired as a registered nurse and nurse educator. So I'm going to call next on Ashley to give a little background. Ashley Cranner.
Hi, good evening, everybody. I wish I could see y'all. My name is Ashley Cranner, and I'm currently the vice chair. And I've been on the board for about 12 years, and I've been working for Monroe County government for over 10, but 10 pretty consistently. I got my master's in public health at Indiana University, and I've really enjoyed my time working with this very smart and talented, committed group of people. Thanks.
Thanks, Ashley. Next is George Hageman. George.
Hi, I've been in Bloomington since 1972. I've been a board member for a long time. I just ran across the curious fact that I was president from 1997 to 2005. So I guess I go at least back to 1997. I'm a retired microbiologist, biochemist from IU Bloomington. And I've been very interested in health-related matters, of PCB issues, the microbiology, which besets us now, among other things. And I just learned that I'm continuing as a member of the Board of Health, too, for another 4 years.
Thank you, George, and congratulations on being reappointed. It shows how important you are to us. Okay, next, Mark Norrell.
Hi, I'm Mark Norrell. I have a background as a hospital administrator. I worked for 25 years in other communities for hospitals and health systems in executive positions. And I came to Bloomington in 2009, began teaching full-time at Indiana University at SPIA, which is now the O'Neill School of Public and Environmental Affairs, in their healthcare management and policy program.
Thanks, Mark. Next is Steve Pritchard. Steve.
Yep. Hello, everybody. I'm Steve Pritchard. I'm a retired dentist. I have been on the board. I didn't know how long, but George, I believe you were president when I joined the board. So it gives me some idea back when it was when I joined. So I've been around for a significant amount of time. I Had a private practice here in Bloomington since 1978. And prior to that, for 3 years, I was in the United States Navy, protecting the Midwest from an invasion of Canadian tooth decay, because I was stationed at Great Lakes, Illinois. And that's my story, and I'm sticking to it.
Thank you, Steve. I learned a lot about you tonight. Carol Talukian.
Hi, I'm Carol Talukian. I'm a retired pediatrician. And I've done a few other things in my life. I was the medical advisor for the public health clinic for a while and done well child clinic, and a few other things. And I've been on the board for, I believe, last we checked, 27 years. I have been president in the past. And actually, I was president when Penny Cottle became administrator. It was one of the best days of my life. Yeah, that's about it.
Thanks, Carol. Bob Brenn.
I'm Bob Brenn. I'm a retired obstetrician gynecologist. I was married in 1966 in Bloomington, came back to practice OBGYN in 1975. And over the years, I've taken care of women, and I've been very happy with the health department, and retired 7 years ago. Been on the Bloomington board lately, and appreciate taking care of people, not necessarily their pocketbook, and looking out for health. That's one of my goals. I've known Penny for a long time.
Thanks, Bob. You were married about the same time I was. Okay, next I'd like to introduce our administrator for the health department, Penny Cottle. Penny.
Good evening. I've been the administrator since 2008. I've been with the health department a lot longer than that. So I won't tell you exactly how long, but a long time. So I'm just glad to be with you.
And I don't know if he's on screen or not. I can't see him on my screen. Is Dr. Tom Sharp with us yet? Does anybody know?
He was trying to get logged in, but tech services says they don't see him yet.
Okay, our health officer is Dr. Tom Sharp, who's been with the health department quite a long time, I believe close to 40 years. So he'll be joining us shortly, we hope. And
Hey,
then,
Kay,
yes.
if you find your little video button at the bottom, I think
You know, I've been looking for it and I'm not finding, oh, I just found it. And it's at the top.
at the top.
But it won't let me.
Oh, that's
in.
right. You're on a MyPad.
Yeah, it will not let me in still.
Huh.
Technical
So,
issues.
technical, if there's a Celinda Leach that you need to let me in. They're asking me to start my video, which I did try, and there it went.
There you
There you
go.
are.
Hey.
Hi.
Nice to see you.
everybody. Okay, is Dr. Sharp on yet? No. Okay, I'd like to introduce next Margie Rice, who's an attorney that is our legal advisor. Margie, are you there? There she is.
Yes. Hello, I'm Margie Rice. I'm a county attorney. I've been a municipal lawyer for about 20 years, and I've been assigned to the health department throughout the pandemic. It's been my pleasure to work with you.
Thanks, Margie.
Thank you.
So that's who's joining the health board tonight. If we look at our agenda, first thing on it is election of officers. When we met last time, we said that we'd be electing officers this time. And if anyone was interested, to please let me know or let Penny know. We have had one person who said she was willing to take on the chair position, and that's Carol Talukian. Thank you so much, Carol. Procedurally, is there anybody else that would be interested or that would like to step up and nominate someone for the chair position? If not, do I hear any nominations?
I nominate Carol Talukian as the chair.
Thank you, Bob.
I second that.
We have a nomination and we have a second. Let's do a roll call. Cranner.
You're muted.
Actually,
Muted.
you're muted.
Kind of screen. There I am. Oh, I wholeheartedly, yes.
George.
Aye.
Mark.
Yes.
Steve.
Yes.
Carol.
Oh, yes, of course.
And you're willing to serve. Ren.
Yes.
And I also wholeheartedly vote yes. So we have a chair. Vice Chair, is there anyone willing to step up?
I nominate Steve Pritchard.
I'll
Okay.
second that.
Steve, are you willing to serve?
I second it.
Oh,
Sorry.
I like it. Yes.
Okay. And we have a nomination. Is that true? I missed who did that.
I did, Carol.
Carol.
I'm sorry, Carol did. And Ashley, you seconded, correct?
Yes.
Okay, so once again, we'll do a roll call. Ashley,
Yes.
George,
Yes.
Mark,
Yes.
Steve,
Yes.
Tolukian, or
Yes.
Carol, Bob,
Yes.
and I also vote yes, and I thank both of you so much. So we have a new chair and new vice chair, and I guess I'll turn the meeting over to our
Thank
new
you.
chair.
And thank
Thank
you,
you.
Kay, for doing all you've done for us in the past. I
Yes.
appreciate what you've done.
What a great
Thank you
job
so
you did, Kay. You
Oh,
really did.
thank you so much.
Yeah, you
Thank
really
you,
did.
thank you,
I second that too.
thank you.
Yes, absolutely. So I guess, and I do want to say that the reason I volunteered to do this is because Kay has worked so hard the last 2 years. And I really feel that she's gone above and beyond, you know, I've been president before and it was not as hard as it's been the last 2 years, let me tell you. So,
All board members have worked hard. Usually we meet 4 times a year, and I don't know how many times we've met this last
Yeah,
2
so-
years.
so
I
I'm
think
happy.
Kay agreed to this role right before we found out about a pandemic.
Yeah,
She
my
did not
first
know what she
meeting,
was signing on to.
my first meeting was the pandemic, I believe.
Well, they're big shoes to fill at this point. I'll do my best, so. So here we are. So public comment is next. Is that correct, Penny?
Yes,
Yes.
Any public comment out there? Hearing none, looks like I don't see anything. We can move on to approval of December 16th, 2021 meeting minutes. Did everyone get a chance to look at them? Are there any corrections or comments?
Kay, you don't have corrections?
I already sent them in.
What's up with that?
I move,
You gotta
approval-
review them first.
I move approval of the December 16 minutes.
Okay, we need a second.
I'll second.
So Mark and George. Okay, and we need to vote now, don't we? So Crainer. You need to unmute yourself.
Can you, I'm sorry, can you repeat the motion? I had to throw dogs out of the house.
Oh, it's approval of the December 16th meeting.
Oh,
minutes.
yes, yes.
George,
Thank you.
Yes.
okay,
Yes,
Mark,
Yes.
Steve,
Yes.
Bob,
Yes.
and I vote yes as well. So the minutes are approved. Public health reports. It says COVID response, public health clinic. Who would that be, Penny? Oh, there's Amy. Hi, Amy.
Hi, good evening. We got our numbers for the year in just yesterday, got them all compiled. You can imagine this year there's a lot more to compile. So hopefully, I don't know if I got them in early enough for them to be in your packets or not. So hopefully you're able to get those. Just highlights from the quarter. Right now, we do not have any TB patients being treated through the clinic, and we have less than 5 latent TB patients. This past quarter, we did 102 outreaches outside of our clinic. Most of those were all COVID related. This past year, we also saw, so this was for the year so far, we went to 169 different homes to do homebound vaccines. And we did that with the help of our fire departments. So we did some of those, but our fire departments did a lot of those. We're continuing that program, and every 2 weeks right now, we're going out and doing mostly boosters. Right now, we are working a small group strep A outbreak amongst our shelters. We put together 200 hygiene kits to be distributed at the park and in the shelters. And the state is getting us some good infographics to put in with those kits to go out with those hygiene kits. We're still mostly focused on COVID vaccines. We still have a clinic going every single day at Miller Drive. We've been doing Saturdays. We are going down to 2 Saturdays a month starting this month. But on top of those 2 Saturdays a month, though, we are adding a mass clinic. So on January 29th, we'll be doing a clinic at Bloomington High School South for those 12 and older. So those kids can get their boosters at that clinic if they like. We'll have 600 appointments that morning. We are still planning to go around to all the 5th grade classrooms like we normally do in the spring and get all those catch-up vaccines. We imagine some kids probably felt a little bit extra behind these last 2 years, the pandemic. And just one more note that I forgot with the COVID vaccines on our ages 5 to 11. So since November, we've given 1,534 vaccines to just that age group of 5 through 11. So we've had a pretty good uptake of that. Any questions?
Hey, Amy, I noticed, I'm sorry, I do have a question. I noticed on the childhood vaccines, I don't have it pulled up yet. Do you mind telling me what the annual was? It seemed, is that low comparable to other years? That one kind of stood out to me.
So I'm looking at it real quick. Total vaccines given, that is a little low, yes.
Okay.
Look at last year's, I can forward you last year's or the year before, because last year would have been probably a little low as well. So that is definitely a concern, is since COVID, kids not staying up to date on their normal vaccines.
So it's more of an access issue, you think, rather than people shying away from vaccines as a whole?
I believe it's more of people just not getting out and making the appointments. So we've been there and available to do them, but we've definitely done mostly COVID and flu shots.
Okay, all right.
Do you have the CASA data for last year, right? It's probably early for that, right?
Yeah, I don't yet, but I can have it probably by next
Yeah,
month.
that'd be good, because I think that because kids get vaccines in the clinic, they also get vaccines other places as well. So look at the CASA data is probably more valid than looking at the actual numbers.
Okay.
So.
I'll request that for the county too, as opposed to just our clinic, because I do think our clinic itself has been really a hub for COVID so much that a lot of kids may have got them more at the pediatricians this year.
Right. Yeah, I'd love to have the county CASA data, because I think that will tell us, and compare it to the last couple of years too, because I think that'll tell us a lot more than what the actual numbers will.
Yeah. Okay. I'll get those to Penny.
Great. Thanks, Amy. Any other questions for Amy? Penny, do you want to say anything about COVID and vaccines right now, or do you want to wait till we talk about the regulation?
I can wait. The team has been doing an enormous amount of work. And Amy, I did want to just, in my mind, clarify, because I know we've been talking about the numbers for the 5 to 11-year-olds. Was the number you gave for those that are fully vaccinated now, the second dose numbers?
No, those
Okay.
were just the number of vaccines we did the last quarter.
So last quarter.
Some
Okay.
of those are fully vaccinated, some only had the 1 dose. So we went to every school and offered every MCCSC and RBB school and offered vaccines during the school day. And right now we're going back in the month of January to get that second dose for those kiddos. But people who went to the mass clinics that we had, they could have been fully vaccinated. So it's a little bit of both.
Do we have county data on the number of kids 5 to 11 and 12 to 18 on that at this point?
There are 8,900 according to the Department of Health. And that's why I was asking Amy, just this week, we were trying to figure out what that might look like. And so we were we can only really pull the data for what we've done. And the 5 to 11-year-olds, when you look at census data, they fall into different categories. So there's not one that just says, oh, 5 to 11-year-olds. So it's a little tricky in terms of that. So we're trying to gather that. That's what we were looking at this week, how many we had done.
That's
and then
8,900, Penny.
8,900 is the estimated number of 5 to 11-year-olds in the
In Monroe
county.
County. Okay.
And some of those have one vaccine, some have two. So it's not the number of kids, it's the number of vaccines.
Yeah.
Okay. So yeah, that's interesting. I think that we've had, I mean, at least earlier on, I haven't looked at it recently, we've had a pretty good response with the 5 to 11-year-olds, which is exciting because they're really the highest risk right now, as far as I can tell from what the stuff I've looked at. So.
Well, I think since our last meeting, Carol, the number doubled because it was only like around the 35 or 4,500 since our last meeting, if I remember.
It was about 2,700 at the last meeting.
Was it? Yeah.
Yeah.
So, I mean, I think we're doing well.
I think they're doing a great job. And I wish some of the older kids would get more vaccines too, because we want to keep all these kids in school. I mean, that's how we're going to keep kids in school is get them vaccinated. So great. Anything else, Penny or Amy, about the COVID vaccines?
Just say after the mass clinic that we're doing on the 29th, our plan is to reevaluate, see how well people responded and do another one if that's what's needed. So.
Well, that's great. So I really hope we can get these kids vaccinated. So great. Good work. And it's a lot of work for you guys. So, okay. Thank you so much. Anything else with vaccines or for Amy? Okay. Next on our agenda is IU. I see Kirk is here. There you are. Hi, Kirk.
I am. Good afternoon. Hey, let me just stop as you're reorganizing here at the first of the year and just thank each one of you. From my days when I was a county commissioner, I know how the fact that you really get paid a lot to do this. Well, you know, you get paid in a different way, and that is the thanks that our citizens really owe you, that debt of gratitude, particularly these last 2 years. So my thanks and thanks on behalf of IU as well. Well, I think Celinda and Penny wanted me to chat about what's going on at IU, and I can give you a quick update and then be ready for some questions. We're back, of course, in person, and we've realized that this high demand for testing caused us to have to adjust a little bit. We were afraid the Student Health Center was just going to get swamped with symptomatic testing requests. And as you know, in a clinical setting, when you have people out the door, it's kind of hard to do your job. And so we came up with a way for our students, faculty, and staff to use a drop-off system so that they get the testing vial and they put their saliva in it. It goes back into a bag. It has instructions. They link it, a QR code to their student or employee record, and then they deposit it back in this collection box. And then we grab all these up and get them over to the lab. That avoids us having to actually stand there and watch somebody do this, but we don't think there's an incentive for people to cheat and have somebody else do it because, gee, if that person came up positive, you'd have problems. So we think this has the same level of integrity, and it's taken a little bit of the pressure off of the demand at the health center. And so that was one thing that we did to improve. But we're continuing all the rest of our testing, the voluntary testing for asymptomatic, and of course the symptomatic and the mitigation testing, which is what everyone's required to do if they're not vaccinated. So that's once a week you have to get tested, and we're continuing all that as well, processed here in Bloomington at our labs. We've updated our quarantine and isolation guidelines to be consistent with CDC. So we moved those to 5 days. So on your 6th day, you can get out of isolation. Right now, I'm happy to report that even through our whole residence hall system, we only have 20 people in isolation. We were ready for a lot more, and that may still happen. We put extra resources behind it just in case. So, but being at 20 right now is really positive in my mind. I feel really good about that because, gee, last year at one point we were up over 150 when fall semester started in 20. We've put out guidance that large events and meetings should go virtual if at all possible. That's a recommendation but we think that's a good way to control the spread. And we've asked that food service and catering operations not be done at these type of meetings if they are held at all. But the preference would be to go virtual. Now, classes are different because that's a much more controlled environment. Everybody is required to mask in class, even the faculty member that's teaching. We've put that requirement back on to the faculty members to leave their mask on while they're lecturing. So classes are, like I say, just much more controlled. We handle violations of the masking policy like we do any other disciplinary problem that you would cause in a classroom. So the students are taking this seriously because they'll suffer dean of students disciplinary proceedings if they violate the policy and disregard what the faculty member is telling them to do. I'm really happy to report that it was a big effort, but that clinic that we did in cooperation with the county and the state from the 5th to the 8th of January, we used the old Church of Christ building that we own up at 800 North Indiana, and the state brought its mobile team in. Boy, that was a challenge because, a month ago when we agreed to do that, the state was plussed up with people and there was a lot of staff. We thought this would be pretty turnkey. They called us the beginning of the week and said, we're out of people and we need your help. And so we dug deep into our event staff and some of our retired nurses at the health center as well. Penny and her staff worked with a lot of volunteers that they have on their rosters in the county. And that's how we staffed that thing. It was very well used. We had a queuing line we set up down 11th Street and down 12th Street. And then you pull in and we use the overhang canopy at the church for the actual testing. And then the sanctuary area was used for vaccinations. And when I was there on Saturday, it was chock full of people, a lot of teenagers, and that was positive as well. So it wasn't just, it was open to the public and you could register on the state site. Now what we're doing is thinking about how we might do that again the 2nd through the 5th of February. We're hoping the state could give us some more resources then. So we're going to do a little after action review tomorrow and see what we might be able to do to get that lined up for the 2nd through the 5th of February. It is currently on the state site as an upcoming clinic. So we've got to get our ducks in a row on that. Numbers wise, we've gone up significantly. The 9th through the 12th of January, we had 300 total cases on the campus. 58 of those are self-reports. That will be all reflected in tomorrow's dashboard update. But I think in many respects, that's less than what we might have seen. And we'll see how the rest of the numbers work out for today and it'll be reported tomorrow for the full 7-day period, but not quite as bad as it could have been. And then finally, one of our biggest concerns is just continuity of operations and staffing. And so far, we're doing pretty well with that. We've had to consolidate some of our dining operations, close some of our dining facilities, consolidate. But so far, we're able to do pretty well across the board with the custodial services, the bus service, dining, residence halls, other support services are holding pretty well, although we are seeing, of course, an uptick in absenteeism, much related to COVID. We have a Keep Indiana Healthy policy in place that gives our employees paid time off to recover. And that's, I think, helped us in our environment on the campus as well. So that's my report for this month. I'm happy to answer any questions.
I have a question. I do. And this is like for you and actually Penny. I mean, we have big numbers in the county, but the numbers you're giving us, Kirk, seems like you said smaller than what you expected. Do you think that perhaps people aren't getting tested because Omicron is just a mild illness and they aren't realizing they should be getting tested, or just kind of blown it off because they figure that's no big deal? Do you think we're getting underreported in this?
Well, what I would say is, yes, there's a lot of underreporting because home tests are not reported, right?
Right.
And so, and if you can't get tested and you just have to stay home and isolate, then that's not going to be reported. So certainly there is a fair amount with this level of transmission. There's no way you're going to have enough testing available, and testing times are increased because of the volume. You know, labs are working 24/7 and still, you know, it's hard to keep up. So that definitely will impact the reporting. So yeah, I think always, all along, you know, your testing numbers are always, the actual number is always higher than what's reported, because there are going to be people that didn't get tested, stayed home, what have you.
Yeah,
Or
I'm just
didn't
wondering,
stay home.
yeah, I'm just wondering if it's just more now because it's a relatively mild illness for people who are not at risk.
I'm going to make it 2 comments. Actually, I'll yield to Ashley. Dr. Sharp just texted me and said he's trying to get in, but he can't get in. And very frustrating. So Ashley, I want to make a comment about our conversation with Scott Dolson after you finished. I'm sorry, but I wanted to make sure they knew that Tom or Dr. Sharp was trying to get in. So Ashley, go ahead.
Oh, okay. I was going to ask if it's useful, and if so, how would one do it to report at-home testing kits? You know, when we get our results, whether they're positive or negative, because I've done one, and I mean, are we even set up for something like that, Penny? Okay.
No. You would have to confirm it. You know, schools can accept them if they watch them, but in terms of it being a confirmed test, the state, you know, you would have to watch somebody. You could have a system perhaps set up where you were watching that test, and you could account for it being that person. The problem with the home test and reporting is I could technically take the test, but say it was my husband's test or something like that. So that's why there are problems with reporting home tests.
Okay, so with home tests, then I think, you know, we would advise best practice for the community is that if they do get a positive test, is to go to a testing center and get that
Get a PCR, yeah.
Right.
Yeah.
Okay. So I think that that's important because, you know, I'm aware of a few people that have gotten the positives and they just stay home. So I think that, you know, this is helpful for the community and those that are watching and listening, that, you know, if you do an at-home testing kit, then do go to a testing site and get that confirmed.
Yeah, and the thing too, I think important is that if you get a home test and it's negative and you really do feel bad, don't believe it, because what I've read, and only about half of our state is Omicron at this point, but so the other half is Delta, so we're picking up some Delta too. But what the stuff I've read is shows some unreliability of the home test for Omicron.
Yeah.
So if you're sick and if you did a negative test and you're still sick, you should go get a PCR.
Mm-hmm.
Quick question for Kirk. After the 5-day period when people are released from quarantine, are they tested before they're set to go out into the community?
No, they're not, because the testing systems that we have, for the most part, we've got some rapid in some departments, but our en masse testing is all PCR. And as you know, you'll test positive for months after your recovery with a PCR test. In fact, I had COVID last month. I'm locked out of the testing system at IU until 90 days after the first onset of symptoms. So I can't get a PCR test. I can only get at IU, I can only do a rapid test. And what we ask everybody, if they do an at-home test and test positive or at some other source, it is a requirement that you report, you fill out our self-report form on our website. so that we can keep track of the fact that you'll be off work, or we have an official record that you've reported that, and that we can help you with your classes or whatever that might be. And then we can also click you into the contact tracing system at that point, and you'll get interviewed about your close contacts.
I bought a chicken if you want something before dinner.
I just have a comment concerning our conversation with Scott Dolson last time and masking at basketball games. I am happy to report to the board, and you can pass this on, and I'm sure he knows this too by now, but compliance, it's just like day and night. Compliance is great now. As a matter of fact, at the last home game, there was one man in sight that didn't have a mask on, and a woman behind him offered to give him a mask, called him out about it, and I could see him looking around because he was going to say, well, what about these people? He couldn't find anyone else. And within 10 minutes, he had a mask on. We just let it go, but we made it clear that it was not, he wasn't fitting in. There was a lot of peer pressure, and it worked.
Well, that's a lot of that. I mean, that's a great report. And I think it's really awareness and some self-preservation maybe that is coming into play here, which is a good thing.
Well, I've heard that from other people as well who have been at games, that the ushers who are going around are actually being a little more enforcing. There's, pointing at people and saying, put your mask on, and that there's been some announcements, I guess, the coaches and the players putting before the games. You've been there, Steve, so you can tell me.
They're saying, help keep us healthy and keep yourself healthy, and they're putting on masks. I mean, yeah, lots of good messaging. The messaging really has improved, and it seems to be effective. And people are wearing their masks the whole game. So, and
I also know people who have tickets on the floor who got actually called from. Actually, one of them was called by the athletic director himself to ask them to wear a mask to protect the players.
Yeah,
who are behind the bench.
Actually, yesterday, Dr. Carroll and the public information officer at IU had their regular session, and they went through some of the things that they have been doing differently at the games. So it is credited to the university's effort, and actually I might trace that back to kind of some of our talk about that too. So
yeah, your comments last month I think made a difference, and Scott tried to take a lot of that back.
That's great. We really appreciate it, because it's a lot. I know it's a lot of work to get masks on all the people in an arena, but you can see that it's made the efforts made. And part of it's the environment too, because people are more aware because of Omicron being so contagious. But I think it's also the effort the university has made to take it more. They were taking it seriously, but to do more things to take it seriously.
It was really apparent on the television, with the Minnesota game I watched on TV specifically. I'm like diverting my eyes from the play. That's hard to do, to watch the crowd, but I watched specifically, and it was just like Steve said, man, much different.
Yeah.
And Kirk, what the university does in this county should reflect to the non-university people the right thing to do. I hope you're setting good examples, and it's on TV. I think that's a good step forward.
Let's hope we can keep it that way.
That'd be great. Anybody have any other questions for Kirk? We really appreciate you coming. We hope you can come every time, because I really like to hear what's going on at IU, because it's such a huge part of our community.
Well, I'll keep this on my schedule, and look forward to meeting with you. We need your help, and I know that you need some of ours, and so we'll go both directions here, do the best we can through this.
Great. Thanks for coming.
Sure. Thank you.
Okay, so next on my agenda is Security Pro. Kenny, you want to take this over?
Sure. Erin Waltz is here to kind of give an update for Security Pro and their efforts, and then we'll talk to you a little bit when that is done too. We've met sort of that contract expense limit. And so if we want to continue with that, then we need to make that request to the commissioners. So I'll turn it over to Erin though, to give you an update.
Yeah. Hey, everybody. sorry I don't have a video feed. I'm on my way back from Indianapolis, but I want to talk real quick a little bit to the fact of we are seeing more mask compliance, and I think it's due to the transmittability of the Omicron. People are taking it a little more serious, I think, now than they have in the last couple months. So we are seeing a lot more compliance. Again, I can't say enough about IU. I was at IU last week, and their efforts for what they're doing for the community and getting everybody to mask up for games and different events. We did work, not for the county, but we did work the clinic or the drive-through testing at the church, which was a great thing that IU did, and had a great turnout for that. If that's a good thing, but we did see a lot of people. There was a lot of people that came through in those 4 days that they did it. So I think people are getting out and testing, and they're taking this Omicron a little more serious than they have in the past couple months. So it's a good thing. Everything that we've visited here lately has been really well on compliance. And that's because of you guys and your diligence that you guys have put forth to the community about mask up and doing the right thing to stay open. And I think that's becoming a little more prevalent to all the businesses in town. They want to stay open, and they know that things are not getting better at the current moment. So they're working a little harder to do the right thing, get people to mask up, social distancing, and all that stuff to keep things going.
That's a good report. Good to hear. Thank you.
Thank you. So do we need to talk about continuing the contract, right?
Correct. So if you would like, we still have the regulation in place. We can certainly still use their assistance. So we can, if you so desire to continue that, then we could take that request to the commissioners next week and extend that contract a little bit longer.
Well, do you have a preference?
Yeah.
Penny?
As long as we have this regulation in place, yes, we need them. And we appreciate their efforts greatly.
Penny, do you have a suggestion on the time, how long to extend it? Can we just say, as long as we have the regulation in place?
Well, the agreement had an up not to exceed amount, but I think that's really with the commissioners to probably decide that. But I think we could even do another not to exceed, 20,000 or 25. If we don't, hopefully we won't get anywhere near that, right? It won't need it that long. But I think we've typically done it around 25,000 at a time.
Do we need to have an actual motion for that, Penny?
Please.
I'll entertain a motion. Oh, Margie, go ahead.
If I could weigh in, one thing I think you could do, if the board wants to just generally say that you would like to support this contract as long as the mask ordinance and regulation is in place, then I think Penny and I can go to the commissioners and work out the details about how many months and the amount. So if that's your preference, is that it's in place, because Penny would like it to be in place until this ends, then I think you can make a motion to that effect. That will be reflected in the minutes. We'll share that with the commissioners, and then we'll do a contract, and we can bring you back the details of that contract next time. Okay. Do you think that that's fine, Penny?
Yes, absolutely. I really think it's up to just the board to say, yes, we want it. The contract is, yeah.
Okay.
I think we owe it to the business to continue. It helps.
Actually, do you
so Kay, why don't you make that?
I will make that.
Wait, hold on. Ashley, do you have something you want to say?
Yeah, I have a question about this. Penny, can you refresh our memory on where the funds are coming from for this for the contract?
I believe they are some type of CARES funds, but the commissioners are covering that cost. So
okay, that's kind of what I wanted to hear, and we thank the commissioner for that.
Right.
So when And then the only other thing I ask is that I'm assuming we're going to get ready to vote on the motion. If passed, can we get an update as to when it will be on the agenda for the commissioners?
Yes,
Thank you.
yes.
So Kay, you wanted to,
Yes, I would like to make that motion that we recommend that the contract be extended as long as we have this mandate in place.
And I'll second that.
okay, any other discussion?
Yeah, just the question that are there any other functions of the security contract beyond the mask mandate? Are they doing any other functions beyond that, you know, if the mask mandate is lifted, does that mean we just no longer need the Security Pro contract? Or are there other functions that they're doing that are necessary beyond the mask?
Yeah, right now that they're helping us with the regulation and compliance around the regulation.
So whatever a regulation says is what they, so if we change a regulation at any point, then, and they're still working, then they would do whatever what they to comply with the regulation.
Right.
But there's more to the regulation than just the masks. There's gathering.
Not right now.
Yeah. Oh, all right. So that's really the sole function right now is the mask.
Yes. So when we did have the broader regulation, then they also monitored those things too.
Got it.
But it is monitoring what's going on, compliance around the regulation, whatever's in it.
Got it.
Okay. Any other comments or questions? So we'll call for a vote. Ashley.
Did we get a second?
Yeah, Steve did a second. What happened to Ashley? I lost Ashley. Oh, there you are. Hello.
I'm here. Yes, yes.
George?
Yes.
Okay.
Yes.
Mark?
Yes.
Yes.
Bob? You're muted, Bob.
Yes.
And I'll also vote yes. Okay, so the motion passes unanimously. Anything else for Security Pro anybody needs? Thank you, Aaron, for being here. We appreciate it.
No problem. Perfect. And I thank you guys for your efforts. I mean, what you guys are doing to keep our county safe is definitely shows. You know, I sit on a call weekly with Lawrence County, kind of the same thing with them. And what we're doing is definitely leading us in the right direction. What you guys are doing, and that's a tribute to what you guys do. So we appreciate what you guys do.
Thank you. Okay, our next is administration. Penny.
Sure. So just some general updates for the department. I do want to say, Kendra, today is her 1 month anniversary. So she's busy taking notes and keeping that for us, and she's doing well. And I am thrilled to have that help every day. So having somebody full-time is wonderful. We are conducting several interviews. We have a vital records position vacant, and our community health specialist in harm reduction is still vacant. So we are busy working on interviews to fill both of those positions, and they are still posted on our website if anybody's tuning in and might be interested in those. I did want to point out our Medical Reserve Corps. We have had fabulous volunteers we've talked about over the past year. And we nominated, well, Shauna, we as a department, but Shauna Wooten, who coordinates our Medical Reserve Corps, all of those volunteers, nominated several senior MRC volunteers to be recognized by Area 10 for being named a Spotlight Senior Volunteer during the last quarter of 2021. And Nola Hartman was selected. And she was in the paper recently, if you saw that. And she has just put in many dedicated hours, truly is a gem and eager to help. And when we talked to her, they gave her this award in December at the mask drive. And she was just like, I don't understand why everybody isn't doing this, you know, and anytime you need something, she's that kind of that first person that speaks up and says, I'm willing to do that. but our volunteers put in almost 5,000 hours in 2021. So 4,620 hours logged by our Medical Reserve Corps this past year. So we're very, very thankful for them. And it is a year ago this week that we opened our vaccine clinic at the convention center. So we've come a long way. As bad as the numbers may be, we have still come a very, very long way. So just wanted to make sure that I shared that. In terms of the school grant, we've talked about that, the money that we have. County Council approved the school liaison position this week. And so we are expecting to have that filled, actually most likely with a current part-time employee that we have. So we expect to be able to get them up and running pretty quickly. We're working with the chamber to figure out a formula so we can have some equity in how we divide those funds among the schools. And Margie and legal is working on MOUs for us with the schools. So we're eager to get that going. In terms of legislation, the Supreme Court, and Margie I made a note about that. The Supreme Court stayed the implementation of OSHA's COVID-19 temporary emergency standards at the moment. And then the state legislation that we've talked about regarding vaccines, that my understanding is that's going to the Senate now to be heard. So that's the updates that I have there. And the last thing I'll share with you at the end of starting a new year, we were looking at our budget reports, and our revenue this year actually matched pretty much 2019's revenue. So that was a nice surprise to see that rebound. Jamie, our financial manager, is doing some looking, and we'll have a more detailed report for you. We're kind of looking at what areas that we saw those increases in that revenue, but we're excited about that. I will invite the HealthNet to come and give a report on the prenatal funds. They just got those funds recently, but I know they served, I think, 12 people this past year, I think was the number, but we'll invite them to come. I just thought it was pretty quick to have them come this time. And then the last thing, and this is just for you all, every year now, you know that there are annual disclosure forms for the county that we have to fill out. And we will be sending those to you so that you can return those to us later in the month. So stay tuned for an email from us on that. And I think that that's all of the general updates that I have at this time.
Anybody have any questions for Penny?
I just want to say, Penny, I'll have to send you a different address because I'm not at home right now.
Okay. Bill,
You email those, right?
yes, I will email
We sign
them.
electronically?
Yes.
Okay.
Yes, and you can email them back. We just need them by like the February 2nd or so. So we'll send all that to you.
Great.
And I'll send you a copy of mine
Okay.
because I have to do one already.
Yeah. Sounds good.
Okay. Anything else for Penny? Okay, now we have old and continuing business. Number one is the regulation review and discussion. You want to take this one, Penny?
I
Or Margie,
will.
or anybody?
All right. Can you see is my screen sharing?
Yes.
Okay, I always hate when it is. Okay. So just to kind of get started, we are in a red advisory. I think we already talked about that. I'll tell you a little bit more about that in just a moment. Want to talk a little bit more about testing. So we've talked a lot about the Gravity site out at Curry Pike. That is open Tuesday through Saturday, 8 to 4. I want you to notice that the address changed. The location has not changed. It is still in that parking lot where the old GE plant is. It's Cook property now. What we found with the that 300 Curry Pike and all that, Google Maps would sometimes take people to the wrong place. They would take them to the wrong entrance and they couldn't get there. So finally, we were able to work with everybody and get this address posted, and I think it's fixed a lot of problems. It is still a drive-through. They've put in some shelters and things, and they have added an IDME QR code registration system and lots of extra signs. And we had reports from citizens who were using it who said, I went in on this day and it took me like 3 hours, and I went in and they've made these changes and it took me an hour. So we've we've received positive feedback on those changes that they've made. Now, the past 2 days, they had to close early. They closed the line early. They are open 8 to 4, but because it's a walk-in, there's no appointments. They cut the line off at 2 o'clock so that they could see everybody that was in line, but still meet their hours. Today, they did close early, but that was due to a staffing shortage. And again, they stopped the line, took care of everybody who was in line, but they weren't able to continue to add more people just because of their staffing issues. So just wanted to kind of provide that. So that is the one thing that I would say, that right now the demand for testing is so high that if you do a home test, I would say just stay home and isolate, because going to try to get a PCR test may just clog things up even more. So, beware of that. Mobile clinics, we continue to request those. We have one requested for the end of this month. Right now, we are waiting on confirmation for that clinic, and we'll post the details once we have all of that set up. Indianapolis Motor Speedway has been extended, and of course, there's coronavirus.in for a list of full options. The Indianapolis Motor Speedway, they added some walk-in only hours from noon to 4 each day. So there are opportunities for those who have resources to travel. Just make sure if you're on that website and you're doing that search, if you've got the means to travel, you can broaden that search, because there may be other counties that have testing available or a mobile clinic available that has openings for you. The mobile clinics, IMS also has vaccination as well as testing, but also our public health clinic continues to do testing. Amy talked to you about that. Next week, they're finishing up those second dose school clinics, but also your providers, your pharmacies are also other options for vaccine availability. And we encourage people to still, if you haven't started that vaccination series, you can start it now. If you need your booster and you're eligible, get your booster dose. So those are definitely available. When we look at our county metrics, so this is last week and this week, this is the 2 metric score. So it is not the advisories, and that's kind of what we focus on, but you can see that there is a lot of red across the state, and every county is in red in terms of cases per 100,000. So when you look at the advisory level, you'll see that there are a few counties still in orange. And when I looked at those today, most of them are pretty close to that 15% positivity rate. So they're on that cusp of being red. There are a few that are still in that 11% range. So they're a little bit further away, but no county is in good shape at this point. And then if you look at, what difference does a couple months make? So November numbers to January numbers, our daily rolling average a day was about 55 in November, and we were concerned about that. That was really high. We want that number to be down, in 10 or below. And then now it is around 250 and rising. Now with that, a lot of people, and I'm sure you are hearing people say, well, you know, I've been vaccinated, I've been boosted, I still got infected. And that certainly happens. But when we talk about those breakthrough cases, it is about 3.7% of the people who are fully vaccinated may still get infected and have one of these breakthrough cases. But a small number of a big number is still a big number. And that's probably the way to look at it. Yes, the more people that are vaccinated, and as we look at this, especially with Omicron, that we are seeing breakthrough cases, it's still a small percentage of the number of people who are vaccinated. The hospital census, when you look at that, they are passing where the peak has been during this pandemic. The staff is very tired. They're having staffing issues as well, with staff being sick. So we're also watching that very closely as well. But with hospitalizations, there's also discussion now about treatments that we have available for certain populations. And you can find information on treatments at both the CDC therapeutics locator, and then the Indiana Department of Health has a treatment page as well. So what I would leave you with today is just transmission level is extremely high, no surprise to any of you. Those who are up to date on their vaccinations have the greatest protection, and testing demand is really overwhelming the system. And that includes not just maybe finding a test, but it also includes taking more time to get those PCR test results back. Rapid tests, finding those is difficult. And the state notified us, I believe it was yesterday, that they have depleted their allotment of rapid tests. So the Indiana Department of Health has no more rapid tests, and they don't know when they are getting more at this time. Our strategies remain the same: masking, washing hands, limiting possible exposure, quarantine, isolation, testing, getting your vaccination, getting your booster dose when that's available to you as well. And I would just say that we all need to take care of one another more than we ever have. And on a positive note, there are signs that the surge may not last for an extended time. Time will tell, but the more that we put our strategies and our vaccination in play, the greater the opportunity for us to slow this surge and get through it. And that's what I have.
I have a question of Penny.
Sure.
Can you please go back to the dashboard map? And maybe it's not even a question, maybe it's just a comment. And I played amateur epidemiologist this afternoon looking at this COVID dashboard. And my curiosity was, what is the granularity within all this red? And it turns out that Monroe County is actually among some of the higher, the counties that have the highest incidence of new cases per 100,000 population. We're not right at the top, but we're in the top half of all the counties in terms of our incidence of new cases per 100,000 in the county. And we've got a mask mandate. And you know, this is kind of a thing that's related to Omicron, is it's like we need better masks to deal with Omicron. So I think that you know, it's a good thing that we have a mask mandate. Of course it is, but I sense that some of our high incidence of new cases over the past week have been because Omicron gets around these cloth masks. So my message is that, and of course CDC is messaging this too. They're saying, now's the time to upgrade your mask, upgrade it to an N95, upgrade it to a KN95, make sure that you don't have gaps, make sure you're wearing it right, make sure you're wearing it all the time, and be cautious about even going into restaurants that, you know, like, you know, kind of the the thing has been, oh, it's okay to take off your mask while you're eating in a restaurant. Now they're saying, maybe you shouldn't. The university now has said in the past, last year, they said students can unmask when they're eating, like in the hallways or in the dining areas, or some of them, kind of eat in the classrooms, even though they're not supposed to, but they took their masks off, and that was okay by policy. Now the university is saying, nope, don't do it. So upgrade your mask.
Yeah, you're absolutely right. And it may also be that, we're doing a lot of testing, so we're capturing more of them, but you are absolutely right. And, what I always say every time I'm talking about masks, one, the best mask is the mask that you will wear. And, the best mask out there, if it's on your chin, isn't going to do you any good. So you do have to factor all of those things in. And you're right. This is a time to make sure to wear the best mask that you can get, and wear it properly, right? And there are, if you have a cloth mask, there are some, they'll hold a filter, make sure they have multiple layers, but make sure they're well fitted. And that's true for a surgical mask or KN95, whatever you have. But that is an excellent point. Thank you.
And also, double masking is better than a cloth mask. I mean, the more, if you can't get a hold of a K95 or KN95, then double mask. Wear a surgical mask with your cloth mask over, but do more than just the minimum. And obviously don't wear it as a chin strap.
A comment and a question for Penny. Masks get wet very easily. Change them frequently. Keep them dry. A wet mask allows the bugs right through.
Good point.
Question for Penny. The city earlier said they were doing wastewater monitoring for COVID-19. What's the story with that? I've never seen any of these data.
I believe that they have it on their dashboard. I think with city utilities, they were part of a study and they've continued it. The mayor usually reports on that some during our Friday press conferences. It is very interesting to see how it goes up and down with our numbers. So it is quite interesting. I have not looked recently, but I'm guessing it is still up somewhere on their website. I will see if I can find that link and send it to you.
It's about a 5-day leading indicator for major infectious incidents in the community. That's been proven through many, many cities and towns.
They showed, I saw this on television last night or the night before, I think it was last night, Boston. And they're seeing a precipitous decline in their sewage positivity rates. So, they're very optimistic in Boston.
Good. So we don't need to do anything about the regulation, do we? Unless you want to change it.
Correct.
Anybody have any burning need to change anything? I see a lot of no shakes. Okay, I think unless someone has anything else to say, I think we're done with this one, right? For now? Okay. Any other questions for Penny about anything? Next on our agenda is new business. There's nothing under new business on our agenda. Anything anybody else would like to say or any board member comments?
Yeah, congratulations on our new officers. Thank you for serving us.
You're welcome.
A lot of work, and I'm glad you took the time to do it.
What about our next meeting? Oh, you're welcome. Thank you, Ashley.
Yep, next meeting is our next thing. So this is January. We're trying to do them every 4 months or so, 4 weeks or so?
4 months.
4 weeks.
To say that's the old days.
So 4 weeks from today is February 10th. I cannot do that night. I have it's something I need to get out of. Actually, I can do that night. Actually, I'm gonna take that back. I can do that night.
I can do that night if we're close, if it's the same time, 4:30. I can't do anything earlier than 4:30 on February.
How's everybody else? How does February 10th look for everybody else?
It works for me.
Sounds like a good day.
Are you thinking early again, Carol, 4:30?
I love 4:30.
Okay.
Anybody have any problems with 4:30 on February 10th? Going
I
once.
I
Okay.
have an event, a dinner event, but don't plan around me. I should be available for most of that meeting time.
Okay, if we start at 4:30, hopefully is there anything big for next time, Penny? I mean, anything like budget, nothing like that, so. it makes it really nothing.
No.
I thought Margie was trying to say something and got blocked out or something.
I don't see Margie anymore.
Can't block Margie out.
Oh, there you are. I see
just
Margie
raised my
now.
hand. I just wanted to let you know that you will have another attorney at that next meeting because I have resigned my employment with Monroe County government.
What?
And I am going to be going back into private practice. So I have enjoyed working with all of you and I'm going to miss working with all of you. You guys are a fabulous board and I have worked with a lot of boards during my 20-year career as a municipal lawyer, and you guys are one of the best. And so you work hard, you're very intelligent, you're responsive, and Penny is lucky to have you guys. So I'm not sure who the new attorney is going to be. They are just now going to be advertising. There will probably be one of the existing attorneys in county legal who will fill in until they make permanent assignments. But I'm going to miss you guys, and I want to thank you for being so kind to me as your attorney.
Well, thank you. Feelings mutual, Margie. Yeah.
Yes,
Thank
we really
you.
appreciate you, and good luck with your new
Thanks.
venture.
Yeah, I won't be leaving town. I'm actually, ironically enough, I am working with a very small firm out of my hometown, which is Peru, Indiana. And they specialize in succession planning and wills and trusts and those things for farmers, which I know nothing about. But they are looking for an experienced lawyer with, the ability to handle contracts and other things that come across their clients' desks that need some help. And so I will be working remotely from right where I'm sitting now, from my home. And I start January 31st. My last day at the county is the 28th, so I will still be around town.
Great.
And so I hope to see all of you in some capacity in the future.
Are you still going to be teaching at the university over at
You know,
Speedway?
I actually gave up the teaching because I thought I was going to be doing this kind of work part-time. They're just going gangbusters and they're really super busy. So the plan was I gave up my teaching so that I would do this work part-time in place of the teaching. And then the more it sort of evolved and they offered me the opportunity to come on full-time because they just have that much work. And they're wanting to sort of grow their practice to be a little bit more full service to their clients. Sometimes, you can imagine their clients are not in Miami County for the most part, they're across the state of Indiana. So you can imagine that farmers in counties in Indiana get involved with local government issues sometimes and need some help working with the assessor, auditor, or, working on a land dispute or they have a septic failing on their property. So, I will be tackling sort of the issues that their clients have that are not will and trust related.
So if you're from Peru, you've probably heard the name Tolucan before you met me.
I did. There were my brother was in high school. Are you related to those Tolucans?
Oh yeah.
Okay. Yeah. I always did wonder that. Who were there were the twins that my brother was in high school with.
Brett and Brock.
Yep. Yeah, we'll have to catch up and have lunch. So yeah,
there we go.
Yeah. Peru's got a few. The firm that I'm working for, they're related. The owner's related to, in her history, to Cole Porter.
Okay.
Yeah, her mom was really cousin to him.
Yeah, there's like dozens of Tolucans up there. It's everywhere.
That you don't hear that, and you're Purdue people, not IU people.
They're Purdue people, exactly.
I know. Yeah. Good. Small world.
Yep. Anyway, so anything else? Oh, Dr. Sharp's here. Hi, Dr. Sharp. I see your face.
Yeah, I've been here a while. I was trying. I don't know about how many of you know this, but I had COVID, and I've been extremely tired. But I'm past the quarantine, but I still was coughing quite a bit, so I didn't want to, although that hasn't happened since I've been here, but anyway, I've been listening. But that's very frustrating. Spend 30, 40 minutes trying to get into this meeting.
Oh dear. Well, maybe it'll work better next time. It'll work better, hopefully.
Yeah.
So we missed you.
Well, thanks.
Good luck, Tom. Good
The
luck.
first part of this meeting.
Yeah.
Yeah,
Yeah.
get well.
Margie.
Feel better soon.
Yeah, Tom, you could have stayed in bed.
Way better. Margie, I'm sorry to hear you're leaving.
Yeah. Okay.
Thank you.
All right. Well, hearing no further business, we can either stay on and be social, or we can end the meeting. We need a
Go to the
motion.
women's basketball game.
There you go.
Minutes to start.
Things to do.
Take care.
Okay. All right. Bye. See you guys next month.